Welcome everybody to today's webinar on improved outcomes treating common lesions on companion animals using cone and bud delivery of cryogen. Before I introduce our speaker, I just want to encourage everybody to send in your questions and the answers will be provided after the webinar. Also, everyone will get a link to the webinar and a general treatment guide that follows along with much of the clinical information that we'll talk about today. Now, our webinar speaker today is Dr. Tracy Cantamesa. She is a graduate of the University of Virginia and then went on to attend Tufts University School of Veterinary Medicine, where she obtained her doctorate. Dr. Cantamesa has many years of experience working mostly in the northern New Jersey area. She is also on staff at Eagle Rock Veterinary Hospital in West Orange, New Jersey, and has a lot of experience using a number of the cryosurgical techniques that we'll talk about today. She also has a heart for many different kinds of companion animals, including exotics, feral cats, and especially loves senior cats. So with that in mind, let's go to some of the questions. Let's welcome Dr. Cantamesa and just have a conversation about how we do cryosurgery with some of the new devices and the new cone and bud delivery of cryogen. So Dr. Cantamesa, welcome. So as we get started, let's talk about skin lesions and the common problems that you find across different breeds of companion animals and older pets that you may see. Can you talk about some of the challenges and perhaps some of the alternatives you consider sometimes to doing cryosurgery?
Sure, of course. So I have many patients that have skin lesions that are generally thought to be benign, but they still do cause some degree of discomfort and irritation to the patients. They're obviously concerning to the owners because a lot of times these patients will repeatedly chew at these lesions and traumatize them. And, you know, they come to me for help, and generally what I was doing prior to cryosurgery is I was trying to piggyback a lot of these mass removals onto another procedure, such as a dental or a cohat procedure, you know, because I struggled a bit with, do we want to do general anesthesia in this older patient for these lesions that are essentially benign, even though they are causing some discomfort to the patients? You know, in addition to the general anesthesia and the risk of that, 'cause a lot of these senior patients that have these lesions are also patients with other concurrent health challenges that may put them in a higher risk category. There's also the added expense to the owners. You know, you're not just looking at the cost for the mass removal, you're looking at IV catheter, you know, perioperative medications, monitoring, and all of that. So, you know, it's a little bit of a struggle to figure out how to manage these. And there were some patients where I would try to do a mass removal under local, which sometimes it would go really well, sometimes it would not go well at all. It really depended on the temperament of the patient. But I found that even really relaxed patients, I really could just do maybe one lesion, and then they wouldn't really be tolerant for me to do a second one, at least at the same time. So, you know, it was difficult to manage these, you know, and so I was having a little bit of a hard time. So I was very happy and pleased to have this alternative option, which has just made things much easier.
Now, do you typically use when you're doing cryosurgery, that is, do you typically use a local anesthetic, or are you able to really not have to use any? And again, we should clarify, we're not going to focus on eyelid tumors or anything like this. So these are, you know, generally speaking, cutaneous lesions, benign, that you'll be addressing, the lumps and bumps that everybody hates, as you said.
Mm-hmm.
So just to keep it simple. And so again, do you usually use an anesthetic?
If I was actually removing the mass, so using a blade or punch or, so be it, yes, I would use a local block. If I'm doing the cryo, I don't actually have to inject anything. What I'm using is generally like a flexible cold pack, a gel cold pack held on the area for about a minute before I do the procedure, but that's really all.
That's good. And the cold pack does what then, for the patient?
Sure. So I think it does two things really well. One, I feel like it provides some anesthetic. I feel like it numbs the area, and chills the area. And then in addition, it's actually lowering the temperature of the mass that I want to treat, which I believe then makes the cryo work even better, because then once I do the cryo, then that core temperature of that lesion drops even lower and we have a more effective freeze cycle.
Yeah, and the patient's more acclimated. It makes sense, just kind of a common sense thing to do. Well, the best way for us to move forward is we can actually show some pictures and a video of Peanut. So let me give everybody the background. We started working together a couple years ago as this product was being developed, and Eagle Rock and everybody there was just great with their willingness to collaborate and test and try, because again, cryosurgery has a great place in the day-to-day veterinary practice with a lot of the senior patients. But the convenience and effectiveness was a bit of a challenge with a lot of the existing products. So we're going to show you the demonstration of a brand new designed cone system that's part of something called CryoMegaVet Dual Delivery. And it's dual because it's got both cones and buds. We're going to focus today on the cones because they're the method that can really work on a lot of these topical lesions that we're discussing. So Dr. Cantamesa, can you talk about Peanut then and the lesion? There's going to be 3 pictures here, kind of a before, a couple days after treatment, and a few weeks later. So if you could sort of guide us through this progression.
Absolutely. So Peanut is one of my senior patients, and he suffers from pretty severe allergies, and he will on occasion pick one of these skin masses and focus on it and chew them and lick them to the point that it becomes a real concern for him, even though the lesion itself is benign. So he was a great candidate for this procedure, and I think the video is going to start and I can show you. I think it just doesn't show the pre-chilling of the actual mass, which I did with the flexible cold pack. And then once we applied the cryo, which I think is coming up in just a moment, I'll choose the cone, basically the right size to just fit over the lesion. And I do these a little bit differently now. In this video, he's actually standing up, but I found that if there's a lesion on the side of the patient, it works best if I lie them down, just so that I'm getting a direct straight down application of the cryo itself.
Okay, great. So again, that was kind of a before, a few days after, and in the end, you can see the lesion is gone. Now let's look at the video of when this was performed. So maybe you can narrate through then. As you said, this is at an angle.
Yeah, it's at an angle, which I feel now having a more straight up and down application is better, but I depress the gun for a couple of seconds and try to fill up some of that cone with some of that liquid, and then I let off the depressor, but I still stay in place and I allow all of that to freeze the lesion, and then I just hold it there until all that's gone, and then it will actually stick to the lesion, so you don't want to back up and try to pull it off immediately. I wait until it comes off naturally, because you see that it's a little bit adhered. And then the lesion, you can tell when they get a little more focused, you can tell that the lesion had a good successful freeze because it turns white. And if you were to touch it, it's very cold and very hard. And then we wait before we do the next application until it goes through its thaw cycle. And the way that you know that the thaw cycle is complete is the lesion will turn back to that fleshy, pink skin color. So it's starting to do that now. and then I repeat the whole process over again, generally 2 to 3 times. I aim for 3 in most cases, unless the patient's very, jumpy and their temperament doesn't allow. And I've had good success with either 2 cycles or 3 cycles, actually, as I've been using this machine.
Mm-hmm. So to give everybody a little background, what you saw in the bubbling of the liquid, that's actually the gas, and what it was bubbling in is a new design for cones. And if you notice, Dr. Cantamesa was using just one hand to apply it. There was no splattering of any gas or cryogen around anywhere or leak, because it fits directly over the lesion once it's picked. And so it gets this very good freeze. And if you watch it now, you can see it kind of melting back to flesh color. And in this case, it takes a little over 2 minutes. And so let's see, in the case of Peanut, this was done, what, 2 more times?
Yes.
Okay. So again, from a procedural perspective, I would imagine you've used other products in the past that maybe had a different way of applying gas with cones. Mm-hmm. Were there issues that you had with those in the past?
I feel that the targeted application with this device is better. I sometimes felt that I couldn't really direct all of the treatment to the one area, and I would have a lot of sort of collateral irritation. Mm-hmm. So I really like how comfortable this is to use, how easy it is to select. So it comes with all these different cones, and you basically select the cone for that particular lesion, which is nice because obviously all these lesions are all different sizes, and I like to use one that's just the right size so that I'm just affecting that particular mass and not the surrounding tissue. So I think the patients tolerate it better, and I really feel like it works with just 2 to 3 cycles. It's very efficient.
That's perfect, and I'm sure everybody appreciates just kind of your insight having used this for a while. So let's talk about some other aspects of this. So when you perform cryosurgery on one of your patients, how do you communicate that to the pet's owners, what they should expect, what they do afterwards?
So when I first started using the cryo, I had the owners, do a lot closer monitoring. I told them they could potentially put a little bit of, puricin or bacitracin on it after. But honestly, now that I've been using it, most clients said that they didn't do anything and the patients were fine. So now I actually don't have them do anything besides bring the patient back for the follow-up, because some of these patients I'm treating either 2 to 3 times, usually about 2 weeks apart. So it's pretty low maintenance on the owner's side. So when I do have an owner express concern, or when I see a lesion that the patient's chewing, the other nice thing is that if there's only 1 or 2 lesions, I can offer to manage those lesions right at the same time rather than setting up a separate follow-up visit, which is a really nice benefit to using this. It does not take long. It doesn't take, the patient to be fasted. It doesn't take them to have any, sedatives or tranquilization. I can just say, hey, do you want me to try to take care of this right now? And most of the time the answer is yes. It's reasonably priced, and basically the way we do the pricing for this is there's a set charge for the first treatment, and then we charge half price for the additional or follow-up treatments, which has been very manageable for the clients, and certainly way less of a financial burden than setting up a general anesthesia or a separate day, hospitalization where the patient has to stay even for a local. So it's been great. I can help right away, which I like.
Yeah, so it sounds like it's good for everybody all around. I want to go back to one point though, with the pet owners and setting expectations. You say one treatment may work, but it may need 1 or 2 more. How do they respond to that? They okay with that generally?
Generally, they're fine with it. They're, like I said, much happier that we can do something to solve the issue. And the other thing too, what I've found is even after the first treatment, if I have a patient that's chewing at a lesion, even if it's not gone, they seem to bother at it less. I don't know if it numbs the nerves or just that drive to lick and chew at it goes away. So really, even after the first treatment, the owners are seeing some benefit to the procedure. And then but in order for it to completely go away, I usually tell them we might do this 1 or 2 more times. And I haven't had to do any patients more than, a third treatment. That's generally been enough.
Would you, sometimes the question comes up, first of all, what kinds of lesions, what sort of breadth are we talking about here? And do you ever do a biopsy prior to or after freezing for some reason?
I have not had to do that. Most of these have been warty growths or those epithelial adenoma type growths. So I have not been faced with biopsying any of these afterwards. And generally these lesions don't exfoliate well, so I'm not typically aspirating them ahead of time.
Mm-hmm. Okay. All right, so let's talk about the impact on the practice and the economics. So you had mentioned already that that this is a nice procedure. We don't have to do a lot of extra things. There's generally no local anesthetic needed, and I can actually answer one of your questions. We know from the literature that cryo does kill the local nerves, so that's likely why we never see anybody picking at it after they get the treatment, which is great. Do all the doctors now within the practice basically refer to doing these procedures with each of their senior patients that they see, or is it something generally the pet owner says, "Oh, I hate that. Can you get that off?" How does this work?
Yeah, a lot of times, if we see a lesion that has obvious self-trauma evidence, we will bring it up. But a lot of times the owners are actually saying, "Oh, he's chewing at this thing on his leg." And actually Peanut, who we just showed that video was from a while back, actually just did another lesion on Peanut last week. So, that owner is very pleased with the results. And so it could go either way. Either we notice it or they notice it, and then we can kind of make the jump to manage it right away. And I'm not sure if I had mentioned to you, but we were a 4-doctor practice for a very long time, and we for almost this whole year now have been a 2-doctor practice. So in addition to the financial burden and obviously the risk of anesthesia of getting these senior patients in for these mass removals, we just don't have the surgical slots right now. So these patients that would be bumped for more pressing procedures, and they might not get surgery for this lesion that they're chewing at, it might be 4 months from now that we can find a spot for them. Now we're doing them right away. We could do them that week or the following week, which is much better, for the patients and for the owners. And just fitting them in our schedule, it's just so much easier. And some of these animals probably just wouldn't get done. We wouldn't manage these lesions otherwise because they either didn't need a dental or we waited so long and we weren't able to get them in the schedule.
Yeah, so it sounds like it fits a niche for you as well as the patient, where it just keeps it simple and you could rapidly take care of these lesions. Now we're not talking about the buds today. We're talking about the cones, and you had mentioned positioning is important, but the patients tolerate this very well. Multiple freeze thaws being key, and that little hint you gave about pre-cooling the area, I think, is one that everybody should remember and write down, because it's not something you'll find in the package insert for the product with the instructions, but it's one that we know, through practice really helps make the procedure go a lot smoother. So I think we've covered most everything about the technology, enough for our attending veterinarians to understand the basic procedures. Now maybe we can kind of conclude and talk about the perhaps your overall feelings about using the product, or how this has developed over time with you as a technique.
So, I'm very pleased with this product. Using it's very easy. I feel that the support that's offered by the creators and the company has been fantastic. In the beginning, I was a little unsure. And then at one point, I wanted to take care of this little poodle, BJ, who had just the whole body was covered with these masses, and the dog was just chronically chewing, and we weren't going to be doing a dental, and we weren't going to be doing general anesthesia, and the dog was really, I think, suffering, you know, to a low level, but still suffering. So it was just uncomfortable most of the time. But the number of lesions was intimidating to me. So actually, I was able to reach out to the company, and they came to the hospital and helped support me actually multiple times while we did the treatments on this patient, which, you know, you don't always have that. And it was really nice and got me really comfortable with using the equipment. And BJ did well, and his owner, who's actually a human physician, was very, very happy with the outcome, you know, and the dog did great. So I just think everything about this product works for me. You know, it's good for my patients, it's good for my clients. I like to be able to help, obviously, and I feel like I can do that right away and get a good turnaround for my patients. So it's just been wonderful.
Well, it's very, very kind of you to say that. And speaking on behalf of everyone at CryoConcepts, we really do want to enjoy developing the science around the product, but two, we know that this affects the patient as well as the owner and their family. And so all of us as people who have our own family members, and by the way, all of them are lesion free at this point. I can say that with certainty, have enjoyed developing the product and basically knowing and watching as it becomes available, becoming a good tool for our veterinarians. And you know, Eagle Rock and you were part of the beginning of this, and so we just really appreciate you taking the time today, and everyone listening. Again, send in some questions, let us know anything that we can follow up with. Again, the product is tested on a peanut as well as many others at this point with great success. So again, Dr. Cantamesa, thank you so much for your time today. I know you guys are really busy, and we very much appreciate you participating in this webinar.
Thank you very much for having me.
Welcome. In this short video, we'd like to give you a quick overview of the CryoMega Dual Delivery Kit, the components that come with the kit, how to use them either with buds or cones. When you open up the kit, you'll notice right away there's a quick start guide on the inside front cover, and the components themselves I have laid out before me. You'll see a series of envelopes, each with a different size tip to be used with the cone style of treatment. And for the buds, there are several boxes of applicators, and you can hear them shaking inside. Let's talk quickly about how to use the product in either a bud or cone mode. First, it's important to use the sizing guide to decide what size lesion you're treating, and let's start with cones. So to treat a cone, and let's use the largest, which is 12 millimeters, we would select a tip from the bag and then the cone adapter, which is inside the kit. We would assemble the tip onto the cone adapter and then place it onto the dual delivery canister of gas. To operate, we turn it upside down, and you'll notice there's a pistol-like grip. We would place the cone over the lesion and pull for 3 to 5 seconds. When we're done dispensing gas, just release the trigger, but keep the cone on the lesion. The gas will evaporate for many seconds after you stop dispensing, and that's where the treatment really takes place. When all of the gas has evaporated, you can then remove it from the lesion that's being treated. There'll be a little bit of gas left behind, but in this demonstration, then you would treat all the lesions you would like on that particular patient. At the end, you throw away the tip and you keep the cone adapter. To do an application or a treatment with a bud, You take one from the box, again, place it in the same place on top of the device. Again, turn it upside down, and again, pull the trigger for 3 to 5 seconds. Once you release, the bud will stay cold for several minutes beyond the initial dispense. You can treat either directly onto the lesion, or you can remove and move about the patient. If you wish to treat multiple times or do multiple freeze thaws, simply come back, again, dispense for 3 to 5 seconds until you're done with that patient, and then you can discard that bud. That's really it. Those are the basic steps for how the Cryosurgery dual delivery operates and the components that come in the kit. Thank you.